Lamborn for 5 minutes.
Thank you, Mr. Chairman. Before I question the witnesses, I first must call for the resignation of Secretary Shinseki. I was waiting for information to be gathered to make my judgment, and now it is in. Based on the interim Inspector General report that came out today, our veterans in Phoenix and maybe other cities have not been treated properly. This report states, quote, "Our review at a growing number of VA medical facilities have confirmed that inappropriate scheduling practices are systemic throughout VHA. The tragic possibility that veterans who have died while on the waiting list have died because of the waiting list is still open. The OIG will hopefully answer this in their final report, though not in this interim report. Even if the Secretary did not know in advance of these wrongdoings, and I don't believe he did, these violations should not have happened on his watch. I believe that Secretary Shinseki's service while in active duty was honorable, but success in the military does not automatically translate into success in the policy and political realms. Here we have a concrete example of the failure of bureaucracy and a failure of leadership. Funding has not been the issue. A supportive nation has not been the issue. The issue is hands-off leadership. Even the Secretary's response to the IG investigation today was a failure. He promises to triage the 1,700 veterans on the secret waiting list in Phoenix. These 1,700 veterans should not be triaged. They should be seen immediately. Dr. Lynch, 1,700 veterans are on a secret waiting list in Phoenix with average wait times of 4 months for a primary care visit. We know of similar stories emerging elsewhere. Why are thousands of veterans waiting months for care at the VA when there is a system already in place to treat these men and women in the private sector using fee basis? If the care is not available at the VA, they can go to any private hospital or clinic and get immediate care. Why isn't that being done?
Congressman, that is being done. There are plans in place to contact every one of those 1,700 veterans by close of business on Friday. Their need for care will be assessed, and they will be offered fee-basis services if appropriate. Across VHA, there is also a process in place which began approximately a week or so ago, and that process is asking each of the facilities to look at their wait lists, to identify those patients who are waiting for care, to contact those veterans, and to offer them fee-basis services if that's what they request.
And I'm glad you did not say that you're waiting for more money from Congress. The money has been given to you. The money is there. In fact, money has carried over each of the last 5 years. From 2010 to 11, $1.5 billion was carried over. 1.1 billion from 2011 to 2012. Even this year, we anticipate $500 million being carried over. So money is not the issue. You would agree with me on that.
Congressman, care is the issue, and we need to assure that if veterans have been waiting, that we identify those veterans and we provide care in the community if necessary.
Okay. Well, I would view this as a type of disaster relief that veterans are entitled to, and the money is there. Ms. Mooney, let me ask you this. I recently spoke with the directors of VA healthcare facilities in Colorado and asked them about whether there are waiting lists in Colorado. They assured me that there was not to their knowledge, but when the information comes out in a report like this that there are systemic problems throughout the country, we have problems getting the documents that we want. Trust has eroded. What can we say to veterans to restore that trust? I think we have a real problem with broken trust.
Congressman, we appear this evening in good faith to answer. The best course of action is the one that best serves the needs of our veterans. We pledge to work with you to get you what you need.
Okay. Thank you, Mr. Chairman. I yield back.
Thank you very much.